Hi, my name is Yuxi Zheng, and I am a senior at Beechwood High School. This summer, I worked at the Cleveland Clinic Chronic Pain Rehabilitation Center under the guidance of my mentor, Dr. Judith Sheeman. My project was on the patient outcomes of headache patients treated in a chronic pain rehabilitation program. To help better understand my project, I would like to first provide information on chronic pain rehabilitation programs, also known as CPRPs. These outpatient programs provide a comprehensive interdisciplinary approach to the problem by focusing not only on physical pain, but also its association with impaired mood and function. Programs typically include physical and psychological therapies in addition to medication management and emphasis not only on patient recovery, but also on maintenance of the patient's well-being after the completion of the program. It is important to understand some basic background on migraines and headaches. Migraine and other severe headaches are prevalent in the United States, affecting at least one member of about 23% of households surveyed in the American Migraine Study 2. Additionally, these conditions have a significant impact on the patient, their family, and occupational functioning, as an estimated 31% of those diagnosed with headache or migraine miss one day of work or school in the 3 months prior to completing the survey. Overuse of analgesics, also known as pain medication, can cause medication overuse headache. This could eventually increase the frequency and intensity of the headache. Since many studies have investigated the prevalence of migraine and headache, but very few have delved into the treatment of these pervasive disorders, the objective of the study is to describe the outcomes of headache patients in pain, mood, and function at discharge, 6 months following discharge, and 12 months following discharge. Given that other studies have demonstrated success of CPRPs in treating patients with diagnoses other than headache, it is hypothesized that headache patients will also show significant improvement in pain, mood, and function at discharge, 6 months following discharge, and 12 months following discharge. Upon admission and discharge, patients are assessed with pain intensity, pain disability, depression, and anxiety. After graduation from the program, at 6 months after and 12 months after, the patients are mailed a survey that includes evaluations for the same variables. A retrospective analysis was performed on a population containing 200 male and female patients consisting of 20.5% male and 79.5% female. These patients were between the ages of 19 and 75 and completed the CPRP at the Cleveland Clinic Foundation between January 2007 and December 2010. They were diagnosed under International Headache Society guidelines with migraine or headache as a major complaint. Patients were tested in pain, mood, and function at all time points. The pain intensity score is a self-reported score and is scaled from 1 to 10, 10 being the worst. This measures the amount of pain a patient is experiencing. The Depression, Anxiety, and Stress Scale, also known as DAS, is a 21-item Likert scaled test. There are 3 subscaled scores, which include depression, anxiety, and stress. However, stress was not measured for this study. This measurement was used to determine the mood of the patients. The Pain Disability Index, also known as PDI, is a 7-item Likert scaled test. It is scaled from 0 to 70 and measures the function of the patients. Repeated measures t-tests were used to compare pain intensity, PDI, and DAS scores between admission and discharge, admission and 6 months following discharge, and admission and 12 months following discharge. The following is a chart showing the results comparing admission and 12 months following discharge. However, all comparisons are across all time points were significant at the p is less than 0.001 level of significance. When looking at the comparison between mean admissions and discharge scores, a large drop for all tests is evident. A lesser, however, still significant drop is evident when looking at a comparison of mean scores at admission and 6 months following discharge. This same phenomenon is seen when comparing mean scores at admission and 12 months following discharge. When considering clinical significance for pain intensity, a drop of at least 2 points in the mean scores must be evident. This was evident at all time points. A clinically significant change, or a categorical shift from severe to moderate or from moderate to mild disability is evident at all time points for PDI. A clinically significant change for DAS is a categorical shift from severe to moderate, from moderate to mild, or from mild to normal levels of depression or anxiety. This occurred in both depression scores and anxiety scores at all time points. Results indicate that individuals had statistically and clinically significant improvement in pain, mood, and function at discharge, 6 months after discharge, and 12 months after discharge. Given the results of the study, it is recommended that further analysis should be done on the effects of gender on patient outcomes. In addition, the effects of the types of headache on the outcomes should be considered. I would like to give a special, these are my references. I would like to give a special thank you to Judith Zheng, my mentor, and Jacqueline Olthoff, and Sarah Davin, and Anthony Tarascavich. In addition, I'd like to thank the Chronic Pain Rehabilitation Program staff for their aid on my research. I would like to give a final thank you to the Office of Civic Education Initiatives.